Hi, everyone. Thank you for joining us today. In this session, we'll talk about strategies to implement a positive, people-centered immunization service experience. My name is Lisa Oot. I'm a Senior Technical Officer with John Snow International, JSI, and I will be walking you through this presentation on immunization service experience. Today, we'll talk about and provide an overview of what is service experience, review the components of service experience, provide practical examples from Ghana and Nepal, and discuss guiding principles. There are three main learning objectives for this session. We want participants to be able to explain the components that make up the immunization service experience, be able to explore how to integrate elements of service experience into your own work, and to be able to generate ideas for how service experience can be applied to your work. I want to start by just exploring what we mean when we say immunization service experience. This term may be new for you, or you may have a different idea of what constitutes immunization service experience. So we're going to provide our definition. What we see is really inequities in immunization coverage have highlighted the crucial component of demand generation and the need for people-centered model for vaccination, where services must be brought closer to people by enhancing service quality and accountability, considering health worker and client perspectives and needs, and bringing people to services with community engagement and development of a social norm. The bridge between these two components is what we are calling the immunization service experience. There are several key elements of a positive person-centered or people-centered immunization experience, service experience. We have components from health system and facility environment, integration of immunization services, public versus private sector experience. We have health worker and client components. We have community components. And then we have outside components such as outreach services and advocacy and leadership and government and community actors that really play a part in multiple of these services. And all of these contribute towards being able to provide quality services and to have a person-centered, a people-centered immunization service experience. We may find in our own context that we need to address one or multiple components within each part, within health system, health worker, and community. So it's important to think about at each level of the system, where do we need to be designing our programming to be most influential? Now we're going to dive into the health system and facility components. So it's important that the facility be welcoming, calming, and be providing of a safe environment. It's important that the look and feel and cleanliness of the health facility. And it's also important to understand that when clients come for services, these are the types of things that can make them feel like they have a quality experience, or they can make them feel as if they don't want to come back for services if they everything is disorganized, immunization supplies are not clean, etc. It's really important that equipment and sessions be set up well, that there are the appropriate vaccine storage and storage of different tools that are available for when clients come for services. For example, in Ghana, we found that the lack of cold chain facilities at the primary level meant that healthcare workers were traveling long distances to obtain vaccines and bringing them back for service delivery points, and that this was influencing their ability to provide high quality services. So the facility environment itself is really important in setting the stage for having quality service experience. When we think about quality of care, we often overlook the quality of care in integration of services. And I think this is a really important quote and point to remember. We understand that integrated service delivery most likely will meet the needs of clients, that often clients want integrated services because they lack time. Everyone's busy. People want to be able to go to one facility and get all of the healthcare services that they need in one place. But often that's not possible. There may be capacity issues within the health facility. There may be difficulty in being able to provide multiple services when out on outreach or providing mobile services. So it's really important to think about what you're delivering and how best to do that when thinking about integration of immunization services. It's important to think about both how integration is perceived by the health workers. Are they being asked to do a reasonable amount of work? But also how they're perceived by the clients and the communities. It's really important to remember that more does not necessarily mean better or higher quality. Sometimes providing integrated services may mean longer lines for clients, or maybe overworked and stressed healthcare workers who are forgetting to provide essential communication about when to return for a second vaccination. Those kinds of things can happen when integrated services are not designed well. So it's something to be mindful of. It's important to think about public versus private sector service experience. And this may be something that you're mindful of in your country, or it may be less of an issue. But what we need to understand is that people often see, private facilities as maybe having greater levels of cleanliness, convenience, shorter waiting time, courteous, respectful, but there's a need to standardize technical standards of care. Public facilities may have better medical quality, comprehensive counseling, better screening, but need to improve interpersonal relationships and efficiencies. So really thinking about how do we really look at what we're able to provide through different services. Health worker and client perspectives. So there's several components here. First, looking at health worker empowerment. So I won't read through all of these bullets, but it's really important that health workers feel empowered to do their jobs and that they have both the capacity and the ability to do their jobs well. So this means providing pre-service, in-service, blending learning opportunities to build their skills and their competencies, that there are feedback and supportive supervision mechanisms that can help health workers if they are having issues with a specific area, that there is the opportunity to create a learning environment so that health workers can have peer mentors, they can work and collaborate with one another, and that specifically they have training on interpersonal communication. This is commonly overlooked, or less attention is focused on this, but it really is truly critical. And this can make a difference when talking with people who are concerned or have limited information about vaccination. It's also really important to understand the motivation behind why a healthcare worker is doing what they're doing. And sometimes something as simple as recognizing a health worker for their performance can really be a motivator for people to do their best work. Capacity building opportunities can also help. Supervisors need to respect their supervisees and listen to them. Providing incentives such as free medical insurance can be a huge motivator for healthcare workers, or transportation to outreach sessions, or to pick up vaccines, as we talked about earlier with Ghana. Those can truly be incentives to doing work. Also, we must consider safety and security for healthcare workers, particularly our female healthcare workers who may be expected to walk long distances and can be fearful for what happens while they're on those roads. It's also important to understand health worker and provider interpretation and perception of service experience. When health workers are supported by the health system to do their job, they enjoy it more, and they do not feel like health education or engaging with the client is a burden. They view themselves as primarily responsible for health promotion and patient education. So client interpretation and perception of service experience is influenced by convenience of services, respectful and dignified care. Are they treated well when they go for services? Provider attitude and communication, higher levels of concordance of social characteristics between patients and providers. The capacity building of health staff in IPC is highlighted as a key to improving the interpretation and perception of service experience. And we've talked about this in the last slide, how critical those skills are. Provider interpretation and perception is influenced by staffing, opportunities for peer mentorship, and also online repositories and support systems that are inbuilt in the health system. Now we'll move into components from the community level. It's critical to engage and understand community voice, get their input, and also understand their demand for services. What we recognize is that community input may not be captured by the existing planning and reporting tools that are available at facility or district level. It's really important that the community is involved in how the interventions are designed and delivered. And we see this done through utilizing different methodologies such as human-centered design, looking at integration of community members into the micro-planning process so that they can help identify where communities are, talk about what services may be best to reach communities, when services are best to be available. There's a lot of ways that we want to encourage community voice to be part of the planning, monitoring, and implementation of immunization service delivery. We can also engage communities in planning and monitoring of health programming. So engage community members into quality improvement teams or linkages, community sessions where healthcare workers and community members are coming together to talk about service delivery issues. It's really critical that the community members are engaged in the immunization programming and service delivery. We can think of community engagement in a couple of different ways. They can be part of health committees, as we've talked about. We can also look at incorporating community scorecards. We can look at doing immunization program exit surveys and client exit interviews so that we can get community feedback after sessions. We can do communication with community health workers who are at the front line of working with community members and are commonly the voice for the community. We can engage in groups that focus on getting insights from community members, such as mother groups or fathers groups. There's a lot of ways that we can engage directly with the community to integrate their perspectives, needs, demands into our immunization programming. It really is important to provide communities with that forum to express their demands, and that this is also an important way to hold the health system accountable for what has been promised. So in your health facilities, really encourage feedback and feed-in loops with the communities. Work to build trust and manage expectations together. Help to share with the community what you're capable as a healthcare worker, what's within your power to do it, and where do you need their help or the help from your supervisors. And this really goes with that last bullet point of don't promise what can't be delivered. Really be truthful and honest with your communities, and maybe work towards problem solving if you can't provide something that's really needed in the community. It's important really to cultivate a sense of community between health providers and the health system, as well as among providers themselves. This peer-to-peer network among healthcare workers is really critical. We really see that it's important to provide a workplace community, a place where supportive supervision is provided on a routine basis, that healthcare workers feel supported in their place of work by their supervisors, by their peers, and that you've built in a structure for peer learning and other opportunities for that collaborative learning. So we've seen this in a variety of ways in a hospital setting where you may have many different staff who can engage with each other on a regular basis, potentially among health workers from different health facilities who come together for a review meeting, or, through new technology or platforms such as the WhatsApp or Telegram, where you're able to share ideas and information and have informal discussions with peers. Those are good options for really reinforcing a strong community workplace. So the quality of the interaction and the service provided is truly critical. Immunization quality needs to be defined and standards understood. And so we have the World Health Organization Quality of Care Standards, the Quality of Care Network, and the IHI Psychology of Change Framework. And all of these really provide standards on what is the quality that should be provided to clients when they come for services. And it's really critical that we are providing the best quality of care. We're now going to turn to some examples from implementation of service experience in two countries, in Ghana and in Nepal. So the quality of interaction and service provision, when we look at the quality of interaction is a very important component, but it needs to be improved. The counseling part is very weak. So what we've seen is that many times healthcare workers don't have the skills to be able to provide high quality communication and counseling to their clients. Sometimes there are language or literacy or cultural barriers that affect the ability of healthcare workers to connect, to communicate with community members. Sometimes it is just a lack of skills. We know that we need to invest really in opportunities to strengthen healthcare worker skills in interpersonal communication, also in how to mentor, and also in terms of really reinforcing clinical skills so that they are providing the highest quality services. It's really important to make sure that quality skills are being met, that the mentor and supervisor skills are able to be effectively monitored and supported, and that those skills are monitored over time so that we understand what are the quality of services that we're providing when we're providing immunization services. Here are some insights from Ghana. What we found is when looking at the perceived quality of the facility environment, that the health workers' experience in a pleasant ambience also created a sense of respect from their clients. That the facility environment can undermine the service provider, causing the client not to fully follow instructions from the service provider. So even if the service provider is doing their job the best, if the facility itself is not providing that sense of confidence, the client themselves may feel like they're experiencing lower quality of services. Also, as talked about, the ability to have the supplies and resources on hand when providing immunization services is critical, and affected the ability to provide quality services and affected clients' perceptions of services as well. So when Ghana looked at these issues, they thought about integrating holistic services for mothers and babies. So changing rooms, breastfeeding rooms, play areas for mothers who come with their toddlers, water sanitation facilities, and so came together to create a more supportive and conducive environment to really make sure that when mothers were coming, or caregivers were coming, that there were really well-designed facilities to meet the needs of those clients. In addition, immunization in Ghana is integrated into a kind of broader service delivery. So it was interesting to think through whether the following existing feedback monitoring processes could also be applied to immunization. So understanding if there are feedback mechanisms to monitor and know when clients are satisfied with immunization services, that didn't exist in a formalized way in Ghana. So are there ways to integrate this so that healthcare workers themselves understand the perspectives of the clients after receiving services? So what they looked at is periodic clinical review of client complaints or requests at outpatient departments, client to service provider one-on-one review sessions with clients' conditions and experiences, and looked at periodic project monitoring exercises and health service provider community engagement during health community sessions and community conversations. And so that these were opportunities to get to do more insight gathering around community perspectives. Now turning to Nepal, here we're looking at the influence advocacy, governance, leadership, and financing had specifically around immunization service experience. So Nepal is unique in that they implemented the Immunization Act. And what this did was really to encourage government to allocate budget for demand generation activities. And really to emphasize the importance of immunization and to build ownership and leadership in the program so that there was sufficient allocation of resources for immunization activities. And so this was really something that has been novel and is potentially a model that other governments could consider following. Looking at insights from Nepal around health worker empowerment, we saw that it was really important in Nepal for within the health system that there be quality equipment and supplies, and that health facilities have what they need to be able to provide services. They needed to assign staff to the correct positions within the health system. They needed to clarify career options, provide guidance or promotions so that that motivation was there for healthcare workers to do their jobs and that they saw these career paths if they were achieving high standards within their work. They're also continued to update health workers with relevant technical information through different communication mechanisms. So this really speaks back to providing healthcare workers with up-to-date information so that they can do their jobs to their best ability. It was also important for to understand in Nepal health worker job satisfaction, to really listen to healthcare workers' voices, to recognize and provide incentives like free medical insurance to healthcare workers, to provide transportation to outreach sessions, to really think about the safety and security of healthcare workers as they have to walk long distances to provide services. And to create a learning environment, particularly for those who are posted in remote areas and have limited access to other resources and technology that can help them with their work. All of these were recognized as needing to be put in place in order to really drive quality of services and motivate healthcare workers and empower healthcare workers. So we have 3 guiding principles for immunization services that I want to talk through just as we're closing. We need to value and integrate communities that we serve into immunization programming. And we need to think about how we do this from the planning stage through to implementation, and then also in monitoring and thinking about helping to monitor even the quality of services. So not just our services happening, but the quality of those services as well. We need to recognize that the quality of services start with ensuring that health workers can do their jobs and do them well. Are healthcare workers provided with, do they have the tools that they need? Are they able to work in a clean and welcoming health facility? Do they have supportive supervision? Do they have peer networks? Are there motivation systems in place to encourage them to do their job? All of these things are really critical to ensuring that the healthcare worker can provide high quality services. Lastly, we're just starting to understand and really measure what can be achieved through addressing the various elements of service experience. So I'll say that, over the next many years, we hope to learn a lot more around what are standardized practice that we should all be implementing for immunization service experience. Maybe there aren't standardized practices or tools that are going to work in every single situation. That's unlikely, but we want to continue to understand what are some of these best practices. And so we hope that you can help us contribute towards that. I encourage you all to really think about this and how you're including immunization service experience in your work. What do you see at the community level? Are you implementing forums for communities to provide feedback into services? Are you providing a voice for community health workers or your nurses and vaccinators to provide feedback? Are you providing that supportive environment for healthcare workers? So be thinking about these things in your own program and own work. And if there are areas where you may be needing to do some adaptation in the way that you're doing your work currently. So next, we're going to think about strategies for different healthcare workers. So frontline healthcare workers, it's really important. And this is kind of the quintessential element of person-centered care, but respect the caregiver and really take the time to ensure that the caregiver understands the risks and the benefits of the services that you're providing. Listen, ask open-ended questions, and be available to them. This is hard for healthcare workers to do if they don't have training or they don't have time. So that's where the system piece comes in to really help provide that to the frontline workers so that they're best equipped to be able to provide that really high quality of care. For supportive supervisors, encourage good practices and identify and address areas of improvement. Look at and evaluate how your staff are interacting with the community members and clients. Are there ways that the health facility or the health system can be better designed to support healthcare workers? Are there individual skills or gaps that healthcare workers have? And work with that healthcare worker to talk through what those are and to help address those needs. And then at the highest level for program managers, really think about establishing and maintaining a network of organizations who can help monitor and evaluate what's happening with immunization service experience. Are there ways that we're able to really understand and do even process measurement around looking at quality of services and overall immunization service experience? And really, we suggest to develop an annual monitoring and evaluation plan for this as well at the program management level. So that is the end of our presentation. I encourage you to please look at a reference that we have, which is Strengthening Immunization Service Experience, Global, Regional, and Country Insight Gathering. And that the examples that we shared from Nepal and Ghana are included among this document. And then we have individual guidance documents as well on Kenya, Nepal. I'm forgetting me, but we have additional linkages if you're interested in individualized country programming as well. Thank you very much for joining us today. We're going to move over into the group work exercise now.